Hi students, welcome to the next session in neural pathology. So we were discussing about salivary gland tumors, and we have discussed more pleomorphic adenoma and Warthin's tumor, the main benign tumors. Now in this video, I will discuss about other benign salivary gland tumors which are important for your NEET examination. Okay, so one among that is your oncocytoma. Okay, oncocytoma. Okay, oncocytoma. So, oncocytoma, it is once asked in your NEET paper. It is, I think, previous 2022 question paper had a question in oncocytoma. So, oncocytoma means onco. Okay, from onco, the term onco. Onco means something which is related to swell. Okay, swell. The onco, the meaning means swell. Okay, swell. And oncocytoma. So cytoma, you can know that this is a benign tumor, and you see a particular type of cell in this, that is oncocytes. Actually, what is oncocytes? Oncocytes are not a pathological cell. Actually, when we get aged, if you see, when the person get aged towards her old age, the salivary gland cells, okay, they get a little swollen up, and they will start having granules inside. Okay, so the salivary gland cells will be swollen up, and they will start forming granules inside this. Okay, so they may have a large gland. So swollen up cells, large cells with a nucleus and a presence of so many granules, they are called oncocytes. Oncocytes is actually a physiological presentation. Okay, it can come in the normal salivary gland as age increases. So if you take the biopsy or a salivary gland tissue from an older individual, okay, mainly after 60 70 years, if you take the salivary gland tissue, you can see these cells. So these cells are sometimes a physiological presentation. Okay, they are physiological presentation, or we say this is an age-related change. Okay, age-related change. The presence of oncocytes is not always a tumor. It's an age-related change. But if it is present in a larger quantity in the form of an encapsulated tumor, then we call it as oncocytoma. The other name of oncocytoma was oxyphilic adenoma. Oxyphilic adenoma. Please remember this. There was a question in the previous 2022 NEET where the option was oxyphilic adenoma and not oncocytoma. Actually, the students, they learned oncocytoma. They had no info that oxyphilic adenoma is the synonym for onco. Okay, so oncocytoma synonym is oxyphilic adenoma, and they said that, sir, there is one option called oxyphilic adenoma, and you never told us that there is a tumor exists like that. Okay, so I always tell them that, I see, don't omit the synonyms. They can put any name in the option. Okay, oncocytoma or oxyphilic adenoma. Now, what is the peculiarities of this oncocytoma? You are seeing this. Can you see this image? Okay, I'm showing this image. You can see that there is so many large cells. So many large cells are here. Can you see this large cell? And the nuclei is prominent here, and the cytoplasm is extremely pink, and it contains so many granules. Pinkish granules are there. So many granules. So these are oncocytes. Okay, oncocytes. So they have a large cell with a prominent nuclei and so many granules. Now, what are these granules? So there was a question. Okay, this granularity in this oncocytes or in oncocytoma. What is that granules? Okay, these granules are nothing but mitochondria. Okay, mitochondria gives the granularity in oncocytoma. See why I am saying this granularity, because when we learned ameloblastoma, in granular cell ameloblastoma, the granularity was due to what? Your lysosomes. Okay, in oncocytoma, the granularity is due to mitochondria. So this is the thing you have to relate and learn. Okay, the granular cells, okay, granules are different in different lesions. In ameloblastoma, on granular cell ameloblastoma, it was lysosomes. In oncocytoma, you are seeing mitochondria. Similarly, in actinic cell carcinoma, you will see granules. Okay, that is due to zymogen. Okay, zymogen granules. So we will see that oncocytoma versus actinic cell carcinoma. We will see now. So how should I know that this is mitochondria? How can I prove that this is mitochondria? So that I can use a stain, a special stain, that is PTAH. I can use a stain called PTAH, phosphotungstic acid hematoxylate. Okay, PTAH, phosphotungstic acid hematoxylate. I can use that stain, and this stain will stain the mitochondria. Mitochondria. So if that stain takes up this mitochondria, I can prove that, oh, this is mitochondria and this is oncocytoma. What else stain I can use? What else stain I can use in a oncocytoma? I can use a PAS stain. Okay, I can use a PAS stain. The PAS stain, if I use periodic acid shift, okay, periodic acid shift, if I am using, I will get a PAS stain that is PAS positive. Yeah, I can get a PAS positive stain. Okay, now there is a stain called PAS diastase. You may have heard about the term PAS diastase. Diastase. Now, what is the principle behind this PAS diastase? How to use this PAS diastase? Or in the options, you can see PAS D. PAS D is nothing but PAS diastase. You know, there is a large what application of this PAS diastase. PAS and PAS diastase. Diastase. What is diastase? Diastase is an enzyme, right? Diastase is an enzyme. Diastase, amylase, tryptase, lipase. Similarly, diastase. What they do, they will digest glycogen, right? They will digest glycogen. The function of diastase is to digest glycogen. Simple. Now you know that PAS will stain glycogen. Okay, and give a magenta color. PAS will stain other aldehyde groups. Okay, aldehyde groups, your mucins. Okay, they will PAS will stain that aldehyde groups, so it will again give positive stain. Now we want to know whether this is PAS diastase. Okay, the PAS stain is due to glycogen or not. We want to check whether glycogen is present or not. On oncocytoma, there is more of glycogen. In oncocytoma, there is a increased presence of glycogen in the cells. So the PAS positivity is due to glycogen. That the PAS positive, it is PAS positive due to glycogen. Now I want to confirm that whether this is due to glycogen or not. So what will I do? Okay, what will I do? I will take a oncocytoma. Okay, and what I will do, I will put diastase. What happens when I put diastase in this oncocytoma? This diastase will go and it will digest all the glycogen. So the glycogen is gone. Okay. Now the glycogen, it will remove all glycogen. Complete glycogen is removed by the diastase. Now if I am doing PAS again, what will be the result? Okay, I did the PAS again. What will be the result? Now the PAS will come negative. PAS will come negative because when I do PAS alone, it was positive. When I put diastase first and then I did PAS, the diastase has already digested and removed all the glycogen. Now the PAS will be negative. So we say it is PAS D negative. Or we say the term is PAS diastase labile. Means it get affected by the diastase. Okay, labile. This tissue is labile to diastase. Means there is glycogen and the diastase has already digested it. Okay, so PAS diastase labile or PAS diastase negative. So in a gist, what I can say, oncocytoma is PTAH positive, right? PAS positive. What about PAS diastase? PAS diastase is negative, or we say PAS diastase is labile. Okay, so this was there in the option. Which among the following statement is true regarding oncocytoma? Okay, which is PAS positive, PTH positive, PAS diastase positive, or PAS diastase negative. Okay, so this they will put this in a puzzling way. Very simple. Okay, oncocytoma contains granules, that is mitochondria, demonstrated by PTAH, and then it is PAS positive. And it contains so much of glycogen, so it is PAS diastase negative. Okay, got it. So this is about oncocytoma. The other term is oxyphilic adenoma. So you got what is oncocytoma. Now let's see one another benign salivary gland lesion, basal cell adenoma. Okay, what you have to learn in basal cell adenoma. Basal cell adenoma is also a biphasic tumor, and basal cell adenoma has some interesting things. Okay, basal cell adenoma, that most commonly it affects the parotid gland. Okay, it affects the parotid gland it is. And mostly you can see that you can see basal cells. What you are seeing? You are seeing basal cells. How a basal cell look like? Basal cells usually have a dark nucleus. They have a cell. We have a cell here, and the basal cell usually have a dark large blue nucleus. Okay, bluish, large bluish nucleus. So you may have seen basal cells, right? So basal cell adenoma, basal cell are usually columnar to cuboidal cells with a large dark bluish nucleus. Okay, that is basal cells. Okay, and what is the histological feature you should know? Histopathological feature. Now you know the cell of origin, that is your basal cells, and your myopithelial cell will also come here. There is a component of ameloid cells also. Now, histopathology, there is actually 4 types of architecture. The architecture here, they have 4 types of presentation. One is solid pattern, solid presentation, tubular pattern, trabecular pattern, and membranous pattern. Please remember, you should remember the patterns, architectural patterns in salivary glands. In the beginning itself, I have told you, you should know the cell of origin as well as the architecture. Okay, which cell is causing the tumor and which architecture they are arranged. They can be either in a solid. Solid means completely in sheets. Tubular means they will be in small tubules like this. Okay, tubule, and trabecular means they will be in trabecular pattern, means large trabeculars. Okay, and membranous pattern means they will be in a puzzle like pattern. Okay, just like this. Okay, you may have played with jigsaw. You may have played with jigsaws when we joined the puzzles, right? The jigsaw pattern is what your membranous type of basal cell adenoma show. Okay, membranous basal cell adenoma show a particular pattern called a jigsaw pattern. And this membranous basal cell adenoma, there's a peculiarity for this membranous basal cell adenoma that will resemble a skin tumor. Resemble skin tumors. Skin appendageal tumor. Skin appendage tumors. So that is a peculiarity. So they can ask you a question: which among the following salivary gland tumor resemble a skin appendage tumor? Which among the following salivary gland tumor resemble a dermal analog tumor? Or which among the following salivary gland tumor show a dermal cylindroma? So that is a relation. Okay, dermal cylindroma look like a dermal cylindroma, look like a skin tumor, skin appendage tumor. All these are due to all these are your membranous basal cell adenoma. Okay, so there is nothing much facts or regarding this basal cell adenoma. Now one more tumor I would like to say, canalicular adenoma. Canalicular adenoma, what is the peculiarity of canalicular adenoma, speciality of canalicular adenoma? See, canalicular adenoma only comes in minor salivary glands. Okay, that is exclusive in the minor salivary glands. It's exclusive for minor salivary glands. And canalicular adenoma is a monomorphic tumor, monophasic. Okay, it is epithelial in origin, just epithelial in origin, and there has a very striking predilection for upper lip. The 75% of the cases, they comes in the upper lip. Canalicular adenoma. Okay, usually minor salivary glands mostly in the palate, right? Minor salivary gland tumors comes in the palate, but canalicular adenoma has a specialty that it mostly comes in the upper lip. 75% of the cases, rest 25 comes in the buccal mucosa. Okay, buccal mucosa. 25% of the cases that comes in the buccal mucosa. Okay, now the architecture, if you see, there is a particular type of arrangement. There is arrangement of this epithelial cell in cords. Okay, it will be arranged in cords of cells. Cords of which cell? Columnar or cuboidal cells arranged in cords. Okay, in cords, and it will look like channels. Okay, it will look like channels. That appearance is called party wall appearance. Just remember the name. Okay, party wall appearance. Party wall appearance is seen in your canalicular adenoma. So this is the facts you should learn about your canalicular adenoma. Now last benign tumor I would like to say is that papillomas. There was one question in your NEET previous paper that is about papillomas. Papilloma of your ductal structures in salivary gland. Okay, so we said ductal papillomas. Ductal papilloma. Ductal papilloma. So from the name indicates, you know that this is some kind of papillary like projection, and this is seen in the ductal epithelium. Okay, this much is clear to you. There are three tumors in ductal papillomas. Okay, please note, first one is inverted ductal. Inverted ductal papilloma, intraductal papilloma, and Sial adenoma papilliferum. Okay, these options, these things you are going to see in the question. Okay, just very simple. Just listen carefully. Just listen carefully once, and you don't need to read it again. Okay, so there is a category of benign salivary gland tumors called ductal papillomas. Okay, there are three entities coming in this. Okay, inverted ductal, intraductal, and Sial adenoma papilliferum. So as the name indicates, inverted ductal. So inverted ductal means it will come inverting into the oral cavity, or inverting into the tissue, or inverting into the connective tissue, inverting into the minor salivary gland. Okay, intraductal papilloma is that these papillomas occur within the duct. These papillomas are occurring within the duct of the salivary gland. Sial adenoma papilliferum is that it will look like papilla in the oral cavity. Now I will tell you what is the difference. Imagine a patient came to you with a swelling in the oral cavity, in the palate. Example, in the palate they have a swelling, and this swelling, the patient has a swelling in the palate, right? In the palate, patient has swelling, and you are seeing the patient. You told the patient to sit. Okay, you are opening the patient's mouth and you are looking into the oral cavity. You are looking in the palate. You see that there is a swelling on the palate with a depression in the center. Okay, so there is a depression in the center. Okay, there is a swelling with the there is a swelling with the depression. Swelling with the depression. That is inverted ductal papilloma. So clinically, inverted ductal papilloma is present as a swelling with the surface depression. Got it? Intraductal papillomas doesn't have any surface depression. So you are looking at the patient, you got a swelling on the palate. There is no surface abnormalities. It is just a swelling. It will look like a swelling. But Sial adenoma papilliferum, you ask the patient to open the mouth. On the palate, you will see papillary projections like this. On the palate. Clinically, on the palate, you will see papillary projection. So that is clinical appearance. Clinically, in the clinically examination itself, we can see papillary projections on the palate or on the area where it is involved, like squamous papilloma, just like a squamous papilloma. Okay, you know, squamous papillomas, they occur in the oral cavity, this papillary projection. So just like that, you can see Sial adenoma papilliferum that clinically appear as a squamous papilloma. So that was the question. Which among the following is clinically appearing as a squamous papilloma? Which among the following show clinical papillary projections? Okay, that is Sial adenoma papilliferum. So only this much concept is enough. This is the concept. Just clear the concept and it is very easy. The question was, which among the following lesion clinically show papillary projections? Okay, so simple. Those who have no idea about it, they will guesswork, because there is intraductal papilloma, inverted ductal papilloma, Sial adenoma papilliferum. There is papilla in every option. Okay, you can't even do a guesswork here. Okay, so if you know the concept, it is very simple. So this is the other benign salivary gland tumors. We have seen oncocytoma, we have seen basal cell adenoma, we have seen canalicular adenoma, and the ductal papillomas. I hope the benign salivary gland lesions is very clear to you. See you in the next video with the next topic.